Hello, and welcome to another episode of Your Family Animal Doctor. I'm Sharon Williams, your host. For all of you animal lovers out there who feel that special bond with your pet, I'm sure you'll be very interested in today's program as we explore the role your family animal doctor plays in caring for all the animals we cherish. Today, we'll visit with doctors practicing specialized medicine at Michigan Veterinary Specialists in Southfield and Oakland Veterinary Referral Services in Bloomfield Hills. And we'll also experience the real-life trauma of the pet emergency services provided at another Michigan facility, the Animal Emergency Clinic of Kent County in Grand Rapids. While most pet owners visit their local veterinarian on a regular basis, occasionally they need the extra special care that can only be found at a facility like MVS in Southfield. Founded in 1990 by a husband and wife veterinary team, this 22,000 square foot facility offers a range of specialized services, including ophthalmology, cardiology, oncology, neurology, internal medicine, surgery, dermatology, dentistry, and emergency and critical care. They see roughly 18,000 patients a year, mostly on a referral basis, and give pet owners a place to turn to when they need specialized care. Dr. Brent Calhoun, the hospital's administrator, explains how specialists work with regional veterinarians to provide services to animals in need.
We work very closely with the veterinarians in this community. We basically serve veterinarians in Western Ontario, Southeastern Michigan, and Northern Ohio. We also have, of course, clients that come from Western Michigan and Northern Michigan as well. And what happens is if a veterinarian has a case where they feel that either their experience or their instruments will not allow them to do the testing or the treatment that that patient's going to need to be able to be either diagnosed or cured, then they're going to send that client or refer that client to our facility.
MVS is staffed 24 hours a day, 7 days a week, 365 days a year. And a typical day is filled with appointments consistent with the specialist on duty that day. Dr. Laura DeLellis, a cardiology specialist and co-founder of the hospital, recently helped Max, a 9-year-old Basenji, deal with a troubling cough.
So Max has been coughing, and his x-ray shows his heart is mildly enlarged, and he has some changes in his lungs. So we're going to try to find out if his heart is the cause of his cough and the changes in his lung, or if it's a primary lung problem. And so we're using ultrasound of the heart, which is called echocardiography, to determine if the heart has a problem. If we determine that his heart is actually normal and is not responsible for the changes in his lung, then we're going to recommend a different procedure called bronchoscopy.
According to Dr. DeLellis, use of ultrasound technology is becoming commonplace when treating animals we love.
We use ultrasound extensively in veterinary medicine now, not only to look at the heart, but also to look at the abdomen. It's nice because it's a non-invasive tool, and depending on what we're looking at, we may turn him look on the other side, we may flip him up on his back, but in general, he's very comfortable and quiet, and we get a lot of information about what's going on inside.
Dr. DeLellis pursued a vocation in veterinary medicine to fulfill her desire to work with both animals and science. And while she says there are a lot of options out there, it's still the client-patient relationships that are the most rewarding.
It's a lot of fun working with the people. It's almost like a pediatrician's role. You have a parent and you have a child, and the communication that goes on as a result, and the emotions are very high as a result of that bond. And it's been very rewarding. The clients are wonderful, the pets are great, and hopefully we do some good for a period of time.
Cardiology is just one of many specialties at this facility. Dr. Debbie O'Keefe, a specialist in oncology and internal medicine, recently examined Buddy, a German shepherd with a small growth near his tail.
So I think the first thing to do is to do a needle aspirate, where we just stick a needle in it We attach the syringe and try to bring out some of those cells. We'll look at those under the microscope and we'll see
Is that
what we
like a
see.
biopsy of sorts?
It's sort of like a biopsy. The biopsy, you actually get a piece that you can send to a pathologist.
And what does that tell you?
Certain types of tumors, like a mast cell tumor, are really easy to see on cytology. They're big cells with big purple granules, so they're really easy to see. Some other types of tumors, we can't tell with an aspirate, but if it's a cyst and we get fluid, or a lot of these guys have sebaceous cysts where they have this thick material inside of them. Yeah, right. And if it's that, we can tell because we get this thick material out that doesn't really have any cancer cells in it, which is what we're trying to prove he doesn't have. We'll do an aspirate first, see if we can save you a surgery, Mr. Body. It's a cyst, but that's good.
After extracting the cells from the growth area, Dr. O'Keefe was able to give Buddy and his owners some good news.
Okay, well, we have the results, and the news is good news. It is just a cyst. When I did the aspirate, all this material came out, and so it is a cyst, which is benign. It's not going to cause him any problems.
And we're sure about this.
Yeah, I'm really sure. So that's the good news, Bud.
Better to check and be safe than sorry.
So that's the good news for Buddy.
Dr. O'Keefe went on to explain the similarities in cancer treatment in both humans and animals and how they can complement each other.
With certain types of tumors, the diseases are very similar. In fact, bone tumors in dogs are used as a model for the treatment of bone tumors in children. And so a lot of the treatments are tried out in dogs first, and then if they help in dogs, they're moved over into the human field and actually we were able to help out kids with the knowledge that we learn about in dogs. Other types of tumors, we take the information from human oncology. We use the drugs that we know work in people, and then we translate that into dogs. And there are some tumors that are really not similar at all.
Specialized services found at MVS can also be found at Oakland Veterinary Referral Services in Bloomfield Hills. This facility is located next to an emergency care center and was founded by surgeon Dr. Lucy Shields-Henney and oncology specialist Dr. Joyce Obradovich. Oakland Veterinary Referral Services is staffed 24 hours a day, providing the specialized care your companion animal needs. Dr. Shields-Henney explains what makes a facility like OVRS unique and the education and training their specialists receive in order to provide pets and owners with the best possible care.
If a veterinarian has a case that they are uncomfortable with, it's beyond their knowledge, skills, they may not have the equipment, in many cases, or be trained with the equipment or have the supplies or skills, then they'll go ahead and refer it. What's unique about a referral hospital, and especially in our case, is that all of us have done residencies and are diplomats of specialty colleges. So we've all done generally an additional 4 years and sometimes more of specialty training in our particular field.
The doctors are not the only professionally trained staff at OVRS. Licensed veterinary technicians with specialized education also play an important role in the care of the animals.
Veterinary technicians are critical to our practices. It's a terrific training program that the technicians go through, and generally each service has a minimum of 1 to 2 veterinary technicians and often some assistants as well. But the technicians generally do most of the patient work. We oversee them and direct them, but as you know, they're taking the x-rays for us. I slant things towards the surgery field because that's my specialty, but they're doing the anesthesia, the preparation for me, handing me the equipment, monitoring the anesthesia, putting the patients in the room, drawing blood, checking when the patients are in the hospital. They're the ones that are administering the medications to them, the IV fluids, walking them, checking on them, and we'll oversee them and check on the patients. But the majority of the work is done by the veterinary technicians, and we couldn't work without them. They're generally a terrific help and a really important assistant for our job.
Dr. Shields-Henney also talked about the lengths some pet owners will go to ensure their pet's good health.
Sometimes it's amazing the lengths that people will go. They often bring in, food, T-shirts, toys. A lot of the pets since I'm a surgeon, they're not supposed to be doing stairs, and that's always a major issue because most of the pets sleep with the owners or sleep on the beds, and so that they usually will end up sleeping downstairs. And it's amazing to me how many times the owners move and sleep with the dog downstairs.
The equipment used is state-of-the-art and often the same equipment used in human medicine. so most clients understand the cost associated with the kind of specialized care their animals receive. There are also some unique practices veterinarians can participate in to make a difference.
What I've tried to do, I think what helps me, because it's a real emotional and almost or sort of a guilt type issue. You feel bad that you see a dog that you know you can help significantly, but just because the owners can't afford it or don't have health insurance for this pet, that they're going to end up putting it to sleep. So what I've tried to do to overcome that somewhat is I participate in a lot of funded clinical trials across the country, that if there's a particular cancer that we're interested in learning about for the sake of people or for the sake of animals or for both, that we can offer some care and pay for it so that the clients can still seek care. And that's been a wonderful experience for me, because it not only gives animals a chance to be treated that otherwise would have been put to sleep, but it gives people a real sense of reward for themselves, thinking that, you know, I'm not only helping my pet, but I might be helping a 12-year-old child with bone cancer at the same time.
Dr. Obradovich noted that pet owners can do a lot to keep their pets healthy by providing them with routine care.
Animals that aren't, that don't go in for regular care, and all of a sudden they go in when there's a big problem noted. Usually if the problem is noted by the owner, it's at a very significant stage, making treatment more expensive and more difficult. But regular care, oftentimes they can pick up a lot of these diseases that we're treating on a specialty level at an early phase where it's an inexpensive and easy treatment to maintain. So obviously, routine general care is extremely important no matter how you look at it.
Both Dr. Obradovich and Dr. Shields-Henne agree that there are challenges to running a facility like Oakland's.
What we do is important. We're doing treatments that are very similar, if not the same, to what they're doing in people, and veterinarians are very, very bad at charging for their services, and we need to do that. So that was the most difficult thing for me in this whole practice, was recognizing that we have to charge for our services, we have to charge appropriately, we can't underrate what we do.
But neither would have it any other way.
And it's nice because I love my profession. I look forward to coming in every day. I enjoy what I do. And that's true with most veterinarians, that we really love what we do. And that's the reward for most of us.
There's plenty more to see and do at these two facilities, and later in the show we will explain more about the unique treatment animals receive at both. But first, let's travel to Grand Rapids and watch an animal ER in action at the Animal Emergency Clinic of Kent County.
We're what is known as an after-hours emergency clinic, and what that means is that we are basically open when the other veterinarians are closed.
95% of the pets Dr. Comer and his staff see at the Animal Emergency Clinic are cats and dogs. The rest are birds and other exotic animals. Approximately 65% of the cases they handle are critical care situations. However, the rest of the cases are emergencies.
There are two classifications of cases we see. One is the true emergency, the kind of thing I think most people think about when they think of an emergency clinic, the trauma type of case or major laceration, something of that nature. The second type of case, though, is what we call urgent care. And those are the kinds of cases where the animal would probably have survived till the next time that they could have seen their veterinarian, but it's medically in the best interest of the patient to have been seen in a more timely fashion. Our purpose here is not to replace their veterinarian, but really to augment